the main topic I want to talk about, which is cholesterol, LDL cholesterol, and the risk of cardiac events doing things like low carb, keto type diets.
Yeah, so, a very big question and still a lot of unanswered components to that question, to be honest. But, what we can look at and what I like to look at is, first of all, when we go back and we look at what are the true risk factors for heart disease, what we see consistently in every study that has looked at this is that if you look at insulin resistance and if you look at elevated cholesterol levels, insulin resistance is a much bigger risk factor for the development of heart disease than elevated cholesterol levels are. One study, more recently, the Women's Health Initiative study, this data was published, I believe, in 2021, and they looked at exactly that question. And the risk associated with having an elevated LDL cholesterol level was 1.4, meaning that, 1.4 times the risk of developing heart disease if you had elevated LDL cholesterol compared to if you didn't. Then they looked at what's called LPIR, the lipoprotein insulin resistance test, another blood test, that reflects your level of insulin sensitivity. And if you had
is that the same as like the fasting, just for clarification, fasting insulin test would be that one?
No, so this is a more advanced way to look, and what LPIR does is it actually looks at the sizes of your cholesterol particles and uses that to determine how insulin resistant you are. And so when you look at the LPIR test, having an elevated LPIR puts your risk of heart disease at 6x the baseline. So
wow.
6x versus 1.4x. So anything that's going to address insulin resistance is going to be much more powerful at reducing your risk for heart disease than things that reduce your LDL cholesterol. And so that's what I choose to focus on. Now, the question of whether LDL cholesterol being elevated in the context of being insulin sensitive, in the context of being metabolically healthy, whether that actually increases your risk for heart disease at all, that's an unanswered question. We have some data that would suggest that it may not be. We have some ongoing studies that are trying to look at that question. But, that's the question that comes up so often for people who are doing ketogenic carnivore diets. They reverse their insulin resistance, they reverse their diabetes, everything looks great except their LDL cholesterol level goes up. And this causes their doctors a lot of concern, but it's not clear that there's any reason that we need to be concerned about that elevation in LDL cholesterol. So it's a very complex issue, and it's a lot of what I spend my time working with patients on to help them understand and to help us, make that decision for people, as to whether or not to continue these diets, whether or not to do, other things to try and lower their cholesterol levels. Very, as I said, very complex issue. We don't have all the answers, but what I do know is if you're improving your insulin resistance, you are significantly lowering your risk of heart disease.
So if I came to you as a patient and I said, okay, I'm doing carnivore, so far I've lost close to 120 pounds. My triglycerides went from like 350 to like 100. My insulin resistance has improved. But you saw that my LDL was around 150. Would you be concerned for me at all?
Yeah, most likely not. There are going to be some other, things that I'm going to want to know. So, it's one thing to know the amount of cholesterol in your bloodstream, which is what the standard lipid panel tells you, the LDL-C number, as you'll see. It's another thing to know the quality of your cholesterol. And this is where we start getting into things like particle sizes, the advanced lipid testing. This is where we're going to get into things like oxidized LDL levels. because that's another part, and I think a more important part of understanding whether or not having too much cholesterol is a problem. And basically what I tell people is if you have a lot of good quality cholesterol, it's not going to be a problem. If you have a lot, or even if you have a small amount of bad quality cholesterol, that may be a problem. So one of the things I have observed throughout my career as a heart surgeon now, 20 years, is that there are plenty of people who end up on my operating table with what is considered a normal or low LDL cholesterol level. And I started wondering, why this might be. If it's all about lowering your cholesterol, then we shouldn't be seeing so many people with low normal LDL cholesterol levels that still end up with advanced heart disease. And this is where I think we are looking at the wrong question. We're looking at the amount of cholesterol when we should be looking at quality of cholesterol. And it turns out that probably the main determinant of the quality of your cholesterol is whether or not you're insulin sensitive. So it all leads back to the same place, all different ways of looking at it. But when someone comes to me with that scenario, very common, that's where we need to dig in a little deeper. We need to see what type of cholesterol you have. The other thing I want to know in someone like that is, okay, do you have any evidence of heart disease or not? And again, we have a very, good test to determine that these days. It's called a coronary artery calcium scan. It's a simple CAT scan. They don't have to put an IV in you. Literally takes 5 minutes to do the test. And in most places here in the US, it's relatively inexpensive, under $200, oftentimes under $100 to get that test done.
Wow. And that's if you pay out of pocket?
That's paying out of pocket because insurance usually won't cover this test for reasons that, we can maybe discuss. But you pay out of pocket, you get the test done, and it will show you whether or not you have disease in your arteries. And that is another very important piece of information, because if you do not have any evidence of disease in your arteries, then probably your cholesterol isn't an issue. Now, there's some factoring in of how young you are. The younger you are, the less of a sort of guarantee that test becomes, but it's still very useful information. And so that's another piece of the puzzle that I oftentimes advocate for people to have that test, because ultimately we don't really care about cholesterol. We care about heart disease. So let's measure heart disease when we can.
That's an excellent way of saying it, versus just focusing on one very narrow metric that may or may not be impacting it. About the insulin test, how accurate, just like the basic fasting insulin that like most PCPs do versus the advanced fasting test? I mean, is it even worth doing the basic one?
Yeah. So first of all, so the fasting insulin level is a great test. And I think it is a test that everyone should be doing. You said that most PCPs do. The reality is that most PCPs don't do anything around insulin.
That's a good point, is most don't, because I had to ask mine to do.
Yeah, no, you usually have to ask. And even when you ask, a lot of them are going to push back because they don't understand it. They don't understand what the relevance of it is. But a fasting insulin level is a very powerful test. And it's going to show you, if your fasting insulin level is elevated, that means that you're insulin resistant. If your fasting insulin level is normal, you still might be insulin resistant, but there's a much better chance that you're not. And, so that's why I don't think fasting insulin alone is enough. And there are some advanced, things that we want to look at, but it's at least a start. And it's going to give you a sense about whether or not, you're on the right track.
Got it.